after having the procedure done on both eyes, the colours have become alive again, which my eyesight had diminished so badly. To go from such poor vision to such amazing vision has been really amazing.
The clinic was established in 1980 and was on Wellington Road in Bulls Bridge, hence the name, the Wellington Eye Clinic. And in 2006, we moved to the Beacon Medical Campus. You can see the Beacon Hospital here behind me, for the simple reason that it's a very good location for the kinds of work we do. So all the laser surgery is done in the clinic, and all the work inside the eye is done in the hospital. The aim of this video is to tell you more about cataracts, what they are, how they impact your vision, and when the right time is to treat them. And then over and above that, we want to help you make the right decision about what lens to put inside the eye. So based on your needs, based on your lifestyle, we want to try and figure out which of the many solutions we have is going to best suit you. The Wellington Eye Clinic is surgeon-owned and surgeon-led. So that means every decision we make is not commercial. The decisions we make are clinical. And we're always going to make decisions in the best interest of patients. The second thing is we have a mission statement that says patient satisfaction is our #1 priority. So we're really about ensuring patients are happy with the service and the results they get at the clinic. And then the final thing which makes us quite different to most ophthalmology practices is we're a refractive clinic. And a refractive clinic means we've got a very specific interest in trying to get you out of glasses with whatever surgery we do for you. So most times if you do a cataract, you simply wear glasses afterwards. But cataract surgery in the clinic is trying to improve your eyesight by removing the cataract, but also by careful selection of the lens, making sure your vision afterwards is spectacle-free. So those are the key things. We have a deep interest in getting very good outcomes. We like to get you free of glasses in the process, and the decisions we make are about patient care and patient safety. So cataract is when your clear lens inside the eye becomes cloudy. And the best analogy is thinking about an egg. When you're frying an egg in a pan, initially you can clearly see the bottom of the pan around the yolk. You can see the bottom of the pan. And that's what your lens is made of, that same material. And then as the egg fries, that starts becoming cloudy and you can't see through it anymore. And that's exactly what a cataract is. That's when the proteins in the lens coagulate and become cloudy. So a cataract operation is when you remove the cloudy lens and replace it with a clear lens. The first thing you tend to notice is that things are more blurry. That would be the general tendency. And then depending on the type of cataract, because there are many types of cataract, you may notice that your vision is worse at night. You might notice that there's more glare at night. You might notice that there's glare in the day. You might notice things like more difficulty reading, but it's typically going to be around quality of vision. So blurring and glare, those are the two key areas.
I first noticed problems with my eyesight probably 2 to 3 years ago, but at that stage it was very slowly progressive, so I wasn't unusually concerned about it. But as time went on, I was thinking, you know, is this more than just an age factor or something, you know? So night driving then became a problem, you know, meeting oncoming cars, lights. I nearly had to slow down and almost stop, you know, that type of thing. It made me start worrying about, you know, as I get older, is my eyesight going to get a lot worse or something like that? So I decided then maybe it's time to start thinking about doing something about it.
Well, cataracts had a huge impact on my day-to-day life. I was having a serious problem. In particular, the ability not to be able to go out and drive at night time for me was so, you know, it was so restrictive. And I felt that, you know, I'm too young not to be able to, or to be relying on other people to drive me around. But in addition to that, I was also starting to have a problem reading newspapers, even with my glasses. I found that the glare from even sunlight was becoming a problem. It was very uncomfortable, and even using the computer, the backlight on the screen from the computer and from my mobile phone was also causing me a problem.
About 5.5 years ago, driving at night became a problem. So much so that I felt unsafe on the road and decided not to go out in the evenings when it was dark, particularly in the winter months. I went to the Wellington Eye Clinic and I saw Dr. Cummings, who informed me that I had cataracts in both eyes. One was a little bit worse than the other. And following various tests and a whole 2.5 hour complete examination, he recommended that I should have cataract eye surgery.
This is something that has changed over the last 20 years. As recently as 20 years ago, we would wait for the cataract to become ripe. That meant the cataract was completely white, you couldn't see anything, and we would then do the surgery. But because surgery has become so safe today, and because surgery is so predictable, we can now do surgery at an earlier stage once you figure that you're no longer satisfied with the vision you have. And what we mean by that is, despite the fact that you've got your newest pair of glasses that are designed to help you most, you're still not satisfied with your vision. That's when the cataract's the cause, and that's when you treat a cataract, when you're not satisfied with the quality of vision.
It was at this stage that I decided, after some research, to book in with the Wellington Eye Clinic for the full diagnostic assessment.
My surgery went far, far better than I expected. I was hoping that I would maybe end up having glasses just for reading small print and all that. But as it turned out, my result was better, and I'm so amazed and so happy.
Cataracts early on are managed by simply following up. The first time we see you with cataracts, we're probably going to find that your vision's still too good to justify surgery, and all we'll say is we'd like to see you again in a year's time. But by the time you get to the point where this is impacting your vision, it's then going to make sense to start thinking about cataract surgery. And the only way currently to correct a cataract, or to correct the vision that you get from cataracts, is to remove the cloudy lens and replace it with a clear lens. As with any surgery, there are risks. The safest procedure in the world, however, is a cataract operation. And currently, the risk is put at 1 in 10,000 of developing an infection, which would be our most serious complication. You also have issues like posterior capsular rupture, or some very technical terms that could lead to things like retinal detachment, or an outcome that's simply not good enough. You can have issues with glare and halos afterwards, but typically following a cataract, there's such an improvement that you don't really notice them. You can be off target, so we've aimed for a particular outcome, but we don't achieve that target, so you might still require glasses afterwards. So there are a number of things that we'll discuss in detail with you on the day, but those would be the key points. The key thing to realize, though, is the benefits with cataract surgery completely outweigh the risks. On the day of your surgery, you'd first come to the clinic, the Wellington Clinic, at which time you'd sign the consent form. Your eye is going to be marked, your forehead will be marked on the side we're treating. We'll confirm things like the target we're doing and the lens we're going to use. And then you walk over the short walk to the hospital. Once you get to the Beacon Hospital, you'll be admitted to the daycare unit, at which time drops will be instilled in your eye to start dilating your pupil. So in order to treat a cataract, we have to have a large pupil. And then when things are ready, you'll be wheeled into the operating theatre. If you're having it under local anesthesia, we'll put the drops in. If you're having it under general anesthesia, you'll be made asleep. And then the surgery is typically 15 to 20 minutes long. And once the surgery is over, you're taken back to the daycare unit, at which time you'll enjoy a nice cup of tea and a piece of toast, and you're on your way home before you know it.
The surgery was very successful. I had my right eye done first, and I was checked up the next day and various other days, and following that in 6 weeks' time, I had the second eye done.
I was a little bit nervous prior to the surgery, particularly on the day of the operation. I think it's probably natural to be a little bit apprehensive, particularly when you're having something done to your eye, which is such a sensitive area. But it was absolutely, there was no need to be worried or to be apprehensive at all. The staff and the team at the Wellington Clinic and at the Beacon Hospital were absolutely amazing. They really put you at ease. I felt so relaxed. I was actually in and out of surgery before I even knew it. I was waking up in the recovery room, and the moment I opened my eyes, I could actually see everything so clearly. It was incredible.
We do cataract surgery and other lens-based surgeries like clear lens extraction and ICL we do in the Beacon Hospital. And the reason we moved out to the Beacon campus is because it's a modern hospital, it's very well equipped, it's well staffed, and we have a dedicated eye theatre. So this is one of the only theatres in the entire country that is used only for eye surgery. And that makes it a very safe environment to work in. We also have very good equipment. So given the technology we have, given the proximity to the Wellington Eye Clinic, the Beacon is just the perfect place to do cataract surgery. So when you do cataract surgery, you're going to remove the cloudy lens and you're going to replace it with a new lens, and you have three choices. You can either choose to make your vision for distance as good as possible, but then you require glasses for reading. So no glasses for walking around, watching TV, but you need glasses for reading. That's called zero. The second option you have is something called monovision. And in monovision, you make the dominant eye zero, so good for distance, and you make the other eye -1.5 or -2, and that's good for reading. So now, with no glasses, you can see both far and near. So the brain basically has two cameras, one focused for far, one focused for near, and all the brain has to do is manage these two cameras. And the third option you have is something called multifocal, or extended depth of focus, or trifocal. All of these lenses are called premium lenses, and in these situations you have both eyes implanted with a premium lens, and these lenses now allow you to see far and near and in between. A good time to do cataract surgery is at the point where you decide the cataract is impacting my vision sufficiently now that this is impacting my quality of life. So things that I used to enjoy driving down to the bowls club in the evening, but I don't want to do it anymore because I'm not happy with my vision at night. That's when it's starting to impact your quality of life. So in today's modern cataract technology and the safety profile that cataract surgery enjoys, by the time you start reducing your quality of vision and that impacts your quality of life, that's the time to start considering it.
I'm about 4 to 5 weeks out of surgery now, and absolutely, it's just been amazing. It's been a great process from beginning to end, and I would highly recommend the Wellington Eye Clinic to anyone really who's having any kind of problems at all with their eyesight.
The impact of the surgery gave me my life back. I no longer was dependent on people driving me at night. My independence was back, and I felt far more confident in my driving. Yes, I would very much recommend the Wellington Eye Clinic. They're very professional, very kind, and very caring.
Small little things like going into a restaurant and be able to pick up a menu and having a look without, oh, I haven't got my glasses, waiting on my wife to pick what she'd have, and then could you pass me your glasses so I can go and, you know, little things like that, or just picking up a newspaper. After getting the first eye done, I was really looking forward to coming back and getting the second eye done. It was that good, really was. I would recommend the Wellington Clinic to everybody.
I've been doing cataract surgery for close to 30 years now, and I think the biggest change has been that we no longer use stitches. In 99% of the surgeries we do, there's no stitch. The incision is so small that it seals on its own. And I think the second part that's really been a big improvement is 25 years ago, our key ambition was to remove the cataract. That would improve your vision, but you would always need glasses afterwards. But given modern technology today and the different devices we have to help us determine what lens to choose, we can put lenses in today that are approaching the target we were looking for. So now we can actually aim to not only improve the quality of vision, but actually improve the quantity of vision. So this means you might have, before the cataract surgery, required glasses to see the television, and now you no longer do. Those for me would be the two biggest changes.